Okay, so I'm going to do a quick live, really quick, because I was asked a question about some aortic aneurysm stuff, and I thought to myself, I can make a good video, but it'll take a long time for me to, kind of like film it and edit it and the whole thing. Hello to Amy and Annie now. I got people coming in now, which is cool. So what I decided to do in the absence of being able to sit down and film and edit a video, which starting next week, I will actually be able to do more of that. But right now, I don't really have a ton of time this weekend to do that. So I put out a video and I said, do you guys have any questions and videos you want me to talk about, things like that? And you can see my video game back there. I got my arcade game. It was somebody named Tamara, and she asked about a clinical situation that she had seen with her father. She said that her father had an aortic aneurysm repair. And then he unfortunately had a bad outcome after the surgery, it sounds like. So what I wanted to do is I wanted to quickly go over aortic aneurysms. Now, this is kind of crude, I'm using the whiteboard, but I want to go over because she actually didn't specify what type of aortic aneurysm. So here we have the heart, of course, right? And now the video may be flipped for you, but what happens is the aorta emerges from the heart and then it arches to the left side of the body, and it runs right down on top of the spine. And then when it gets into the abdomen, there are some other arteries that come off here that nourish the, like the spleen and the intestines and things like that. But the key for aortic aneurysms is their location with respect to the renal arteries. Okay, so the renal arteries come off each side, and of course I've drawn these little kidneys here. So and then we have the continuation of the abdominal aorta, which then splits into what's called the common iliac arteries. Okay, so you got the right common iliac and the left common iliac. So here are our options for aortic aneurysms. We have the aortic root, which is the part right where it comes out of the heart. So this is the aortic root. You can have an aneurysm here. You've got then the aortic arch, where it's literally arching, okay? So you don't see that very commonly, but the aortic root aneurysm is more common. Then you have the descending thoracic aorta. You can have an aneurysm here. And then, you can really have an aneurysm anywhere, but these are the most common sites. Then you can have what's called a suprarenal aortic aneurysm, supra meaning above. So an aortic aneurysm in this region here. And then we can have the infrarenal aortic aneurysm, which is going to be down here, okay? So that's going to be down here. So she didn't specify, but she said that her father had an aortic aneurysm repair. So it could have been the root, the arch, the descending thoracic, suprarenal or infrarenal, okay? And so just so people watching this, because a lot of people watch my stuff, maybe they don't have a medical background. An aneurysm is a pathological, meaning abnormal dilation of the blood vessels. So aortic root aneurysm would actually look a little bit more like this. It would balloon out, okay? A suprarenal aortic aneurysm would balloon out like that. Or an infrarenal aortic aneurysm would balloon out like that. So why does it balloon out? Well, it balloons out because of damage. You can either have a connective tissue disorder, so people with Marfan's and things like that. But the most common thing I see is damage to the aortic wall. And that is typically due to things like long-term atherosclerosis, smoking, things like that. Where you get the aneurysm. The aneurysm is a dilation, and the problem is that when it dilates and it starts to dilate, the wall is weak. And if the wall is weak, then it is more likely to rupture, okay? So that's what we're talking about here. We're talking about these different sites. But the question that Tamara posed was that, if I understand her comment correctly, she said that the aneurysm was repaired, which means maybe it had not ruptured yet, and they went in to repair it so that it wouldn't rupture in the future. And then after the surgery, he began to bleed profusely from basically, it sounds like all orifices. And she asked me, why did that happen? Well, first of all, let me say that with just that little bit of information, I can't tell you exactly what happened. I can give my thoughts on what might have happened, but there are many different reasons why people could bleed out like that, okay? So we can see our little, our diagram here. You can keep that in your head. I'm going to put that to the side. I don't know that I need to refer to that right now. But when I see people bleeding profusely, especially at the time of death, and they're bleeding from their nose and their eyes and their mouth, and they're bleeding internally, usually that means a couple of different things. The most common being that that person was on anticoagulation therapy. So things like heparin, things like warfarin, Coumadin, you know what I mean? So we're talking about preventing blood clots. There could be other medications for that, depending on what the medical history is. And so then what happens is, if you can't clot because of medication, then you're simply going to bleed. So the most common reason would be medication. So my comment to Tamara would be, was he on anticoagulation therapy? And people that are post-operative, sometimes they are on anticoagulation therapy, and they do that because blood clots can form, okay? Blood clots can form from being immobile. And thanks to everyone coming in and saying hi. I'm doing a little quick lecture on aortic aneurysms. If you came in late, you can just wait till the thing uploads and then watch it, because it's going to be a very short live. So I would say number one would be, what medications was he on? Number two, it would be things like, was he having a platelet? Was he chronically on low platelets? So our platelets usually run between 150,000 and 450,000. And when it's below 150,000, we call that thrombocytopenia. Now, if you're sitting at 120 or 95, you're really probably not going to spontaneously bleed. But when you get down below 30,000, 15,000, 10,000, that's where spontaneous bleeding could come in. So my second point to you would be, do you know anything about what his platelets were? Sometimes people can they can go into what's called disseminated intravascular coagulation, which can occur due to sepsis, or it can occur after surgery. And what happens is it consumes the platelets. So the platelets, if they are consumed, then they cannot work to form clots. And if they cannot work to form clots, then you bleed, okay? So then my third idea for why this bleeding might have occurred would be underlying medical conditions that we have not talked about, such as liver failure, okay? So the liver is very important in producing coagulation factors for the body. So what I see is, when people have liver failure, they will sometimes spontaneously bleed. They'll start vomiting blood. They'll spontaneously bleed into their abdomen. They will sometimes have a bruising that's so widespread over their body, just the smallest little bump will cause them to bleed. So my third thing I would say is to Tamara is, did he have any kind of underlying condition like liver failure or a poorly functional liver? So, that's the main stuff I wanted to address for this particular case. And of course, there's 100 or even 1,000 different variables. That's why sometimes when people ask me questions, they'll say, my uncle had chest pain and he died. What happened? Well, I mean, it could be a zillion different things. And so I try to answer as best I can with the information that I have. And so, excuse me, I'm going to answer the question about fatty liver in just a moment. So I hope that answers. So the thing is, when we're talking about aortic aneurysms, I want to be clear that aneurysm is the pathological dilatation. It doesn't mean that the rupture has occurred. An aneurysm, when someone says so-and-so has an aneurysm, that doesn't mean that it's actively bleeding. A ruptured aneurysm is when somebody's actively bleeding. You can live with an aneurysm. But the problem is when the size gets a certain size, then they feel they need to surgically repair. So if we go back to the diagram and we look at this or even this, last I knew, about 5 centimeters in diameter. Beyond that, they start to think about repairing these surgically. So 5 centimeters is going to be, the size of a very small lemon, maybe would be a good way to explain how big that is, okay? So that is, the story of the real basics of aortic aneurysm and repair. Now, as far as why so many people that die after surgery, it's sometimes difficult to identify why they died. And in fact, a lot of what I do is somebody dies after surgery and then they give me the case and they say, what happened? And sometimes I can answer. Sometimes I have found some stuff that nobody even thought of. And other times I do the case and there is simply no answer. Now, in the case that Tamara described, there was active bleeding. And so when there's active bleeding, especially from the orifices and the mucosal membranes, then you have to start thinking about things like low platelets, clotting disorders related to clotting factor deficiencies, disseminated intravascular coagulation, possibly even from sepsis if there was an infection. So I want you to think about these sort of things. And I'm speaking specifically to the person who asked the question, and maybe that will help understand. In cases like that, sometimes they will order an autopsy to try to figure it out, and in other places they simply won't. In the main place where I work, they will order an autopsy in that case. But sometimes it's physiologic, and we aren't 100% sure why it happens. Now, Angela asked the question with regards to bleeding and liver disease. Does fatty liver fall under that? And my comment to that would be a pure fatty liver, you can have abnormalities of clotting. But if it's a fatty liver that is not an end-stage liver, so to speak, let's say it's fatty liver due to obesity, or let's say it's fatty liver due to a medication, fatty liver due to diabetes, long-term diabetes and hyperglycemia, I don't really see people spontaneously bleeding with that kind of thing. What I see it with is end-stage liver with end-stage viral hepatitis or alcoholic cirrhosis. That's really when I start to see people spontaneously bleeding. So think about those things. But I would not say fatty liver by itself. I mean, fatty liver is actually very common. I'd say if you took all of the autopsies that I do and all of the ones that I have done, I would say somewhere between 25 and 50% of the entire population has some degree of fatty liver. The really bad ones, the people who are like hard alcoholics that are drinking, vodka every single day, their liver will be bright yellow and very firm and waxy. And then Leah says, happy birthday. Thank you for that. My birthday was June 5th. And some of you remembered and sent me a little message, and I appreciate that. And it's never too late to wish somebody a happy birthday. Now, what did I get for myself? You see that arcade game back there? That Miss Pac-Man arcade game, that's what I got for myself, okay? So I'm setting up this room here. This room is kind of like going to be half my arcade and half my studio, because you can see there's a ring light back there. So it's not really set up yet, but that's what's going on. But anyway, if anybody's coming in late, you can go back and watch the video. This is a very short live tonight because I've decided, in lieu of making these long videos that are super nice edited, thank you, Rachel, for the birthday wish. I decided I'm just going to make a live and address the question, and hopefully that'll help. But starting sometime next week or the week after, I'm actually going to have time to sit down and make videos and edit them and maybe get good lighting and not have a bunch of junk in the background. So at any rate, I guess I would at this point say, does anyone have any questions based on what I've talked about? So again, we talked about the aortic aneurysms. We talked about post-surgical complications, particularly with bleeding. Thought of you the other night when my senior friend choked at the table in a restaurant and some young man did the Heimlich on her. She couldn't breathe and he saved her life, in my opinion. Oh my gosh, that's crazy. I think that choking is one of the scariest and most underrated things that occurs. I mean, a lot of people don't think about that. They think that's a thing that used to happen and doesn't happen anymore. But I have 3 to 4 unexpected choking cases per year that I do. And that is a small percentage, but that is way higher than it should be. And certainly the Heimlich maneuver has saved many, many lives. And that's scary because if you don't get on it quickly, then, people can die. They become hypoxic, because the entire mechanism of how people die is that the windpipe is blocked. And then at that point, you start to get hypoxic. Your oxygen goes down and your CO2 goes up. You lose consciousness. And then at that point, you've only got a couple of minutes before irreversible brain damage is done. I get scared when I see people eating fast and talking, which unfortunately, I'm not perfect. I do that sometimes because when you go through medical school, at least when I went through, you have almost no time to eat. So you have to do a shift, or you have to be on the wards, and then you have to go down, eat really quickly and get back. So I unfortunately conditioned myself to eat very quickly. But it scares me, so I try to chop up things very small and not cram a bunch of food in there. And I would encourage you all to do the same. So with that said, now I'm not going to be on very long. As you can see, I've been on for 18 minutes. It's a real short lecture, quick lecture. I just wanted to answer that person's question. Hopefully she sees this. And then some of the other questions that were asked in some of the threads, I may try to do them as, I guess what would be thought of as a flash live. Real quick live, I come on, make it, and then, people can watch it later. I'm sure people are going to see this later. It seems like when I do a live, we have people in here about somewhere between 15 and 30, but then after a couple of weeks, I have hundreds and hundreds of views on these lives. So people are watching them, and I appreciate people coming in and watching them after the fact. And, I'm sorry about your friend. I hope that your friend is doing okay, because that is very scary. And with that being said, I think I'm going to go ahead and get off here now. And I will, like I said, I'm going to be making more content. Anybody who's been following the YouTube page recently, I've been on a string of trying to make at least one short every day. So thank you, Papa Smurf from New York City, a place where I will be in November. But I will talk about that when the time comes. All right, thanks everybody for popping in, and thanks for everyone who's watching this later. And I'm gonna go play video games now. I'm gonna play Pac-Man, or maybe Dig Dug or something.